Okay, good morning, everyone. I'd like to call to order the Board of Supervisors Health Committee meeting for Monday, February 22nd. And we have one item today which relates to submitting a letter to the California Department of Health Care regarding county organized health system. We have three folks who are going to present today. Scott Coffin from the Alameda Alliance, Colleen Chavla from the head of the Alameda County Healthcare Agency, and Lori Cox, Alameda County Social Service. So I don't know what order you're going in, but Supervisor Carson will be here shortly. Okay.
Good morning, Supervisor Chan. Actually, Mr. Coffin is going to be doing the bulk of the presentation. I thought I would just add some introductory remarks before he goes into the presentation. But essentially, all counties in California have Medi-Cal managed care, and there are different models in different counties. Our county has a two-plan model, which means that we have a local initiative and a commercial plan that compete for business. And there's a rare opportunity that the state has put forward to create a pathway for a new model, or a different model, not a new model, but a different model to be chosen by a county. And what's before you today is really preserving our right to look further into whether a different model is appropriate for Alameda County. It's a non-binding letter of intent that we would be asking your board for approval on, and you're at a full board letter. But it would give us time to do the analysis that would be necessary to determine whether a different Medi-Cal managed care model would be appropriate for our county. So that's the general overview of the presentation today, and I'll turn it over to Mr. Coffin.
Thank you, Colleen. Hi, good morning, Supervisor Chan, Chief Executive Officer for Alameda Alliance for Health. If we could, here we go. There we go. The purpose for this presentation today is to request approval from the Alameda County Board of Supervisors to submit a non-binding letter of intent no later than April 30th, 2021 to the California Department of Healthcare Services that expresses interest in potentially changing the Medi-Cal delivery model in Alameda County. As Colleen Chavla shared a couple minutes ago, we have several partners here in Alameda County. This list here starts at the state and runs all the way through to a local level with our providers. Alameda Alliance for Health is the public managed care plan for Alameda County, and has been a partner since 1996, since its formation. Some current numbers in regards to Medi-Cal enrollment. There are 395,000 residents being served today. 229,000 are adults, 117,000 are children, and 48,000 seniors 65 and older. And about half of those enrollees are served through safety net providers. For Medi-Cal managed care, 82% of the enrollees choose the Alameda Alliance, and 18% have chosen Anthem for their coverage. And again, this is a summary here. It shows the 58 counties in California and how they're structured today. Alameda County is a two-plan model. And again, the list that breaks down here has 6 different model types. So a little bit of background on the letter of intent opportunity. As stated earlier, Alameda County's delivery model is a two-plan model, and it's served by both Alameda Alliance for Health and Anthem Blue Cross. The California Department of Healthcare Services hosted a public meeting on October 15th of 2020 and invited county leaders to consider changes and apply for changes in the structure of their Medi-Cal delivery system. And then they held a subsequent meeting on February 8th, 2021, and provided more clarification on the letter of intent process. Alameda County can submit the letter of intent by April 30th, 2021. There are some approvals needed to make these changes. Some are at a local level in terms of county ordinance, some are at a state level in terms of state legislature, and then also at a federal level. The roles of the county agencies remain the same. Healthcare Services Agency, Social Services, doing the determination and redetermination enrollment eligibility functions. And for Alameda Alliance for Health remains as an administrator for the Medi-Cal managed care delivery services. This chart shows a comparison of the two delivery models. On the left side is the two-plan model, and on the right side, far right column, is the county organized health system. The differences remain in the beneficiary choice, which is the third row down, and that is it goes from a two-plan structure or two-plan option to a single option for members, and Alameda Alliance for Health would be that plan. And then secondly, at the very bottom on Medi-Cal procurement, by going through a delivery system change, we would not participate in the Medi-Cal procurement process if approved. Good morning, Supervisor Carson. My name is Scott Coffin. Yes, doing well. How are you? So some of the considerations, and as Colleen outlined in the beginning of this presentation, we would be looking at and assessing the opportunities, the benefits, the risks for changing the Medicaid delivery system here in Alameda County. These considerations that are listed before you are an initial set as we've looked at the opportunities of what would change and what would be the benefit to the members, the Medi-Cal members, as well as the Medi-Cal providers. One opportunity it provides is further alignment between the safety net providers, the partners that we have today. And it also allows for more community-based governance. There's also a continuity of care that is established for the members and easier navigation across the system, which is one of the challenges that people face today in the Medi-Cal system. Quality of care is a top priority today, and it would be in the future. But making sure that we have quality and access to the necessary services at the necessary times, and really focusing in on targeting health disparities for our Medi-Cal members would also remain and is a top priority. For the provider, simplifying some of the processes that they go through today with having two plans. There are two submission processes for claims. There are two regulatory processes, a lot of duplicative work, and also with quality incentives, there's duplication there as well. So there's an opportunity to refine that down and standardize. And then lastly, long-term infrastructure to better coordinate the resources. This is more of a strategic long-term implication with all the changes that are planned by the Department of Healthcare Services over the next 5 to 7 years. This is through the CalAIM initiative and other policy changes that are on the horizon. We see this as an opportunity to explore a different way of delivering Medicaid services. So back to the purpose for today and the request. The letter of intent is a non-binding document. It is approved by the Board of Supervisors and authorized by the Alameda Alliance for Health through approval from the Board of Governors. And once that letter is authorized, it's sent to the Department of Healthcare Services. And what it allows us to do is perform the due diligence to really identify the true level of effort, the risks, and the benefits for changing the Medicaid delivery system here in Alameda County. So again, two steps that we would take. One would be to assess the impact to the Alameda County Healthcare Services Agency, Alameda Health System, Alameda Alliance for Health, our health centers, and other safety net partners, and then present the findings of the assessment back here at the Alameda County Board of Supervisors Health Committee in the second quarter of this year. Thank you.
Okay. I had a couple questions. On your map showing the different models, there's no, whatchamacallit, key for the, so are the codes the blue stripy ones?
The county organized are the are the green up top.
Oh, the green at the top.
Yeah, the way that this is a state map that has been provided by Department of Healthcare Services, and the legend is a little difficult to follow, but there's 22 counties in the state that are county organized, and we could provide as a follow-up, a specific designation of those counties.
Okay. And then in terms of the 82-18 split here between the Alliance and Anthem Blue Cross, is there still a default mechanism or not?
Yes, there is a default mechanism today, and that applies to Alameda Health System and our other federal qualified health centers, or FQHCs.
Okay. And then in terms of, I mean, I sit on the Alliance board. Supervisor Carson doesn't attend those meetings because I'm assigned. Can you talk a little bit about the, kind of the satisfaction scores or satisfaction with the current Alliance? Because there were some issues before, and kind of how the Alliance is doing. I mean, I know that, but it might be good to put it on the record.
Yeah, over the last 6 years, the satisfaction scores for Alameda Alliance for Health have continued to improve each year, significantly from 2014 when the Alliance was placed in state-run conservatorship. But over the last 6 years, we have improved our customer service, allowing for members to be calling us and asking questions, and us following up on those questions with actions such as changing primary care providers or assisting with other questions on benefits. So our customer service has improved along with that satisfaction scores.
Okay. And at the time the state makes this decision, is that the time where they're also going to be bidding out? I mean, if we've remained a two-county plan, they're going to bid out that second group. Is that when they're going to do it as well?
Yeah, the process as reported so far by the Department of Healthcare Services is that somewhere in the time frame of November or December, the procurement process will start here in California. At that point, or just prior, each county that is submitting a letter of intent would need to confirm which direction they're going to take. And so that would probably occur sometime in the October timeframe. And that's why we wanted to start with an assessment right here, assessing the impacts at a local level and make the determination earlier than that deadline.
And it's probably expected in Alameda County that others than Anthem would bid for that. Is that correct? Or it seems like it.
Yes, I would assume they would.
Yeah. Just because there's also a financial impact for the Alliance, isn't that correct? I mean, if we have a so-called competition and they're very active in their pursuit of membership, it could affect the
Yes.
bottom line of the Alliance.
Yes, there could be. On average in the state, in two-plan counties, the local initiative, which the Alameda Alliance is for Alameda County, the average is around 65 to 85% market share in terms of enrollment with local initiatives. So there could be some adjustment or reduction in membership if we go through the procurement process and if we remain as a two-plan structure.
Okay. Colleen and Lori, do you have any opinion? This is just submitting a letter. It doesn't bind us to doing it. So how are you all feeling? Your department, IHSS, is dependent on the Alliance, and 82% of our Medi-Cal population is dependent on the Alliance.
So Scott had actually discussed this with me a couple weeks ago. We walked through it. At this time, we don't have any concerns with submitting a letter of interest.
I would say the same is true for healthcare services. I think it warrants a review. to see what the benefits and risks would be and whether we would want to move forward with any kind of a plan change. I think that this just preserves our ability to do that over the next several months.
Okay. Do you have any questions?
No, I've actually followed it since Supervisor Gale Steele kind of initiated it. I know it's in 22 counties, the state of California, and obviously this is just an opportunity for social services, healthcare, along with the Alliance to kind of meet and discuss it with the Department of Health and Human Services, healthcare for the state of California. It's going to come back to us. I'm okay with it.
Okay, so we'll forward it to the full board, but there shouldn't be any problem. Thank you. Okay, I think that's the only item we have today. Wow. Okay, are there any public comments? No public comments? Okay, we're adjourned. That was fast.